So my story began actually when I was 10 years old. My mother was diagnosed with breast cancer, and I really had no idea what that meant other than that she was sick. And so she went through a year's worth of treatment, and eventually it went into remission. And so she was in remission for about 13 or so years. And then in 2010, she was diagnosed with a form of ovarian cancer. And so that started a whole new round of treatments and doctor's appointments and surgeries, part of which was genetic testing. They said, you know, since she'd had breast cancer and now this, that she was a candidate for testing specifically for the BRCA1 or 2 genetic mutations. So she had the testing and tested positive, which prompted testing for both my brothers and I. We tested positive as well, so that was a scary time for me and resulted in me just sort of pushing that aside and choosing to ignore it for probably the better part of 5 years. And I have a group of very good friends that we've known each other since we were, 7, 8 years old. And we were having a girls' weekend, and they'd asked, how I'd been doing. My mother had recently passed. Just kind of catching up, seeing how everybody was doing. And I told them about my genetic mutation result. And a friend in that group was in medical school at the time. And she said, well, can I ask what you're doing about it? And I said, well, nothing really right now. And she said, can I just tell you that I think that's really irresponsible? And it took me aback. But we'd been friends for so long, it was okay for her to say something like that to me. Sure. And ultimately, she was right. I was being irresponsible. I had all of this information that could drastically impact my health, and I was doing nothing about it. So that was kind of the kick in the pants that I needed to go and get some more information. So I started looking into my options for surgeries, and that's ultimately where things really started moving forward. So I found a team of incredible doctors at Cleveland Clinic through a friend of mine and a mentor who had just finished her breast cancer treatment. She said, you have to go check out these surgeons, they're phenomenal. So I did, and I just fell in love with them instantly. Just really, really wonderful women and extremely talented. And so my surgery was scheduled for December of 2015, almost a year to the day after my mom died. So I went through a bilateral mastectomy, and they started the reconstruction process, which then I had a second surgery for in May of that would be May of 2016. So I had that surgery and have had a couple more since, just to finish the reconstruction process. But I'm all done with surgeries now for a while, which is great. Feeling wonderful, and just the peace of mind, I think, that it brings has been life-changing, truly.
Were you 100% with your decision? Did you feel like you knew this was the right thing to do?
Yes. For me, when I found out that I had the BRCA1 mutation, it really took breast cancer in my life from a matter of if to a matter of when. And so, the information that I was presented with basically said that I was looking at an 85+% chance of being diagnosed before age 70. That was way too high for me, especially just seeing what my entire family had gone through with my mom. I didn't want to put them through that again. So when I saw those numbers, it was like, I could take my risk from over 80% to under 10.
Sure.
And that's huge, really, really huge.
So tell me about what this was like watching your mom go through that. That had to have been such a huge motivator.
It was. Watching someone you love go through treatments and surgeries, you wouldn't wish it on your worst enemy. It's truly heartbreaking. But on the other side of that, we were able to get some time with my mom that was one-on-one, just our family, and it was so nice to have that time together. And it's time that I wouldn't trade or give back for anything.
Sure. It puts a whole different perspective on life.
It does.
This value-added time.
Yes.
I think.
Absolutely.
So talk to me about your family. What's your family look like? Are you married? Do you have children? Is your
Yes.
dad still around?
Yes, so my family now is my immediate families, my husband and I. We live here in Erie, and then my dad, and I have two younger brothers. One is married with a little one, my nephew Ben, who has just been a godsend, really. He just brings so much joy and love to the family that we're so, so thankful for him.
Sure.
Yeah, so that's my family, and we're not too far apart. My dad's down in Meadville. We're here in Erie. My brothers are in Pittsburgh. So
Do you push your brothers to look out for their health?
I try to. They're probably not as diligent as I am, but I always encourage, and I know my sister-in-law helps me with that a lot with my one of my brothers to go get your regular checkups, and because they. My grandfather, my mother's father, also had breast cancer shortly after her second diagnosis. And so, they are at a slightly increased risk as well, not nearly what I was at, but
Sure.
so they do need to be careful. They need to have their exams as well.
So this is something that touches so many people. And when you come across people who have somebody in their family dealing with this, what do you say to them? How do you help them?
Yeah, probably one of the most important things that my family did when my mom was going through all of her treatments, spending time together, laughing, just finding the bright spots in every day and in every situation, because it can get pretty heavy at times, especially if the diagnosis is terminal. It's a lot to handle, and so the laughter and keeping the lightness is really, really important. I remember the first time my mom went through breast cancer, my youngest brother was, probably 6 or so, and he used to love playing with her wigs. He would put them on and run around the house, which my mom wasn't
That's
necessarily appreciative of, but enjoyed the humor in it. So just things like that, those are the positive memories that I have that I associate with my mom's treatment and recovery process, and I'd much rather focus on that than the sad, heavy stuff.
Absolutely. And I'm sure you've learned so much from your mother.
Yes.
And so much from this process.
Yes.
What do you tell people so that they can have hope in the process, though you've seen the worst of it?
Mm-hmm.
What do you tell them?
That's kind of where my involvement with the American Cancer Society came in, is that there are organizations out there doing so much work to bring hope to families and to patients through research, looking for a cure. That's ultimately what we're all hoping for, is a cure, right? So no one ever has to go through this, or doesn't have to be afraid of a diagnosis. And so that's what kept my family going, keeps me going personally, is that there are organizations like the American Cancer Society doing wonderful, wonderful things to help us hopefully get toward a cure.